Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe to learn and grow daily. Now to continue our ECF and ICF discussion. So we spoke about ECF and we also spoke about ICF. So let's quickly recap what we have done with the ECF. So under ECF we saw the important ones, that is being sodium, next the calcium NCC. So there was calcium and next there was the chloride. The next batch we had the HCO3 and the glucose. So the important values here is sodium being 142 and everything was in milliequivalents per liter. So the important ones, the calcium was 2.4, the chloride is going to be 103 and bicarbonate is going to be 28, glucose as we saw it was 90. So this was some important things, and we also discussed some important cations, the major cation being the sodium and the major anion being the chloride and the buffer being HCO3. So this was a summary of the previous the part 1. Now moving on, we also discussed about the ICF. So talking about the ICF, there was the potassium. The potassium, the ICF was 140, and then we also discussed about the phosphate being 75 milliequivalents per liter, then proteins being 8 times higher, that is it is 40 milliequivalents per liter. Now looking at the other components, there is the sodium. The sodium in ECF was 142 and here it is going to be 10. Next we look at the calcium. The calcium is negligible. The calcium was 2.4 and the calcium here is going to be very negligible, that is 0.0001. Then looking at the chloride and the bicarbonate. The chloride is 4 milliequivalents, the 4 milliequivalents per liter, and then looking at the bicarbonate. Bicarbonate is nothing but 10 milliequivalents per liter. Then moving on to the glucose. So what happens in the glucose? The glucose is nothing but it was 90 in case of the ECF, and here it is going to be minimal, that is 0 to 20 milligram per DL. So the glucose value we discussed was in DL in both cases, that is ECF also as well as the ICF. Other values were in milliequivalents per liter. Next, moving on to the pH, it is 7, and the osmolarity is going to be 281 milliosmol liter. Then looking at the major cation and anion, the major cation and anion in case of ECF was Na and then Cl, and in case of ICF, the major cation and the anion. The major cation being the phosphate and the major anion being potassium. The major cation being potassium and the major anion is going to be the phosphate. Next, we move on to the buffer. So what acts as buffer in case of the ICF? So in case of ICF, the buffer is going to be, there is a protein and there is also going to be the phosphate. So these two are the buffer which are acting. So what is the most osmotically active ion? The most osmotically active ion. So this is going to be nothing but the potassium here. To watch more videos like these and grow daily, subscribe to the Dr. Hub channel.